Just like The View, only without all the annoying broads, it's the Medicare for the Lazy Man podcast. A Medicare podcast that brings a tear to the eye. He's a former resident of the old Pueblo, Medicare expert Doug Jones.
Hello, everybody. Welcome to another episode of the Medicare for the Lazy Man podcast. This is the only podcast I know of that actually stars me, Douglas B. Jones, as your Medicare expert or your Medicare specialist. I am here to help you gain the confidence that you're going to appreciate when Medicare time arrives for you. And it may be that Medicare time arrived and passed, or it may be that Medicare time is approaching, but one way or the other, it always helps to be confident. How can I imbue that confidence in you? Well, I would suggest purchasing my book, Medicare for the Lazy Man 2024. Now, I've mentioned this about 1,000 times, but I still feel there must be a couple of people out there who have not yet bought and read Medicare for the Lazy Man 2024. So I'm going to describe what you have. What you have here is a hand-holding device, a how-to deal with Medicare on its simplest terms. Here's what Medicare is. Here's what I think you ought to do about it. Here's what's going to happen to you if you don't follow my suggestions. And at the end of the book, there's a happy little chapter that says you might have made a mistake years ago. You might have gotten bad advice. Let me try to help fix it for you. And so from start to finish, what you have here is a warm and fuzzy introduction to Medicare and to the best way to protect yourself against medical bills that could otherwise destroy your finances. So where might you get this? Well, you can go to barnesandnoble.com, and there's a paperback on sale with beautiful, colorful illustrations. Or you can go to amazon.com, where the paperback is available with black and white illustrations, plus the Audible book, the Kindle version, which is instantly available to be sent to your Kindle reader if you have one, and of course the magnificent hardcover book. It's a little on the pricey side, but it is a magnificent creation that Amazon has created just for me and just for the most motivated of Medicare bon vivants. So go to the store of your choice, get the book, and then join me for future podcast episodes where we discuss the finer points of Medicare. Speaking of finer points, I see a guy on my screen who has kind of a pointy head, but it's very fine. He's got it honed to a fine edge. It's Randy Carson. I'm glad to see you out there, Randy, sitting in the middle of the Monument Valley.
It is, that I love sitting in front of the mittens, and people probably, if you don't know Monument Valley or haven't been to Arizona, don't know what the mittens are, but they are a very iconic picture, and I love the picture, so I use it quite often. But bottom line is, I sharpen my head quite often.
Well, you do a fine job of it, I have to tell you, but the mittens are an iconic Arizona scene that you find in many, many pictures. And then you also find the iconic saguaro cactuses in many, many pictures. If you see a cartoon or even a photograph of somebody and they're near one of these volcanic mittens, or they're near a saguaro cactus, we always know exactly where they are. The interesting thing to me is that the mittens and the cactuses are not anywhere near each other in the state of Arizona.
Right.
The cactuses won't grow in the Monument Valley, and the volcanic activity didn't occur down where we are in the desert.
Yeah, absolutely. And, I always like to come forward with a few fun facts. Well, that, saguaros, I've got a couple saguaros in my front yard. And those of you who are familiar with saguaros and how they go about growing, they don't get any arms until they're about 40 to 50 years old. So until that happens, all you've got is this thing that looks like a little rocket ship.
Yeah, exactly right. Exactly
And
right. Still got
and
thorns
so
on it though.
oh yeah. Yeah, you don't want to get anywhere close to one of these things. But bottom line is I've got a couple in my front yard. One has arms, and obviously I haven't been here for 75 years, but they are also very tightly regulated and tracked. And I bought those, the ones that I've got in the front yard. I bought those from a dealer. And
Uh-huh.
how you get a saguaro from a dealer is they go by, they need to be moved. You cannot destroy a saguaro, or someone in Arizona will come destroy you. So bottom line is you have to buy them from a licensed dealer, and where a licensed dealer gets them is from someone who has to give them up or have them moved because of construction or whatever the case may be. So bottom line is I got a hold of some with arms. I got one with arms, I got one without arms, and then I got a little tiny guy that looks like a little tiny rocket ship.
Ah,
And I'll never see him have arms, but I'm still there, and I love the looks of them. And bottom line is they're expensive.
yeah.
You can buy I won't bother telling how they price them, but bottom line, any kind of a saguaro at all is going to cost you probably about $1,000, $1,200, and that's even on the inexpensive side.
And I've heard that even when professionals transplant them, let's say that somebody's going to build a subdivision, which happens all too frequently in our area of the county. Maricopa County is huge. And all of a sudden, we're seeing big tracts of land that are being scraped. And what they do is they move all the saguaros and the plants that they want to save off to one side, build all the houses, and then scatter them back in amongst the houses. But I've been told about half of those don't survive the transplanting process.
Well, I believe that's true, and one of the reasons potentially is that you have to put a saguaro back in relationship to the world, in relationship to the sun, exactly the same, or it can't make it.
Right. And I think that's because they get sunburned. So they have a side that's immune to the damage that the sun's going to cause. And then the other three sides are less protected.
I'm the same way. I
Yeah.
have, I have one side that's immune to sunburn.
Well, my dermatologist will tell you that I do not. And so therefore, every time I go see this guy, he likes to laugh and squirt my spots with Freon. I think it's Freon anyway.
That's always fun, isn't it?
Well, what's really fun is when I scare small children, on the way home. That's I look like I look like a Medicare Advantage.
Oh yeah, well, we don't want any of those going on because Medicare
No,
Advantage zombies. That's a bad idea.
It really is. It really is. Speaking of that, I think we might want to spend a Medicare Advantage minute at some point during this episode.
Well, let me pick my number.
Please do. I wrote the numbers down.
I did this very, very scientifically. I put this all in a hat and I shook it up and then I drew one out of the hat. I am going today for number 12.
Okay. I do like your scientific method. That's excellent. I'm going to suggest that in the future if you forget about it. Okay, article number 12. Let's see, it's going to be toward the back. The stack is getting smaller, and I have to tell you, I've got a whole new stack of items ready to go for when we finally run out of these things. These are fresh, new Medicare Advantage articles that I think the audience is going to enjoy. At least you and I will enjoy them. And
I always enjoy them.
Okay. So number 12 here, the headline on article number 12 is many Medicare Advantage members find challenges with plans survey find. So there's a survey that has found that many Medicare Advantage members find challenges with their plans. This was highlighted by the content curator, and she started about halfway down. So I'm going to skip the earlier part of the thing and go right to her highlighted portion, which says, when considering Medicare Advantage plans, beware of promises. These private insurance. Now, they always use the word private insurance as though it were a pejorative. We don't like private insurance. We only want government insurance. This is where the other enemies of Medicare Advantage plans and I part company, because I love private enterprise. I love competition. I do not want to see the government in control of our health insurance. But just remember that whenever you hear the word private insurance, it is our fellow Medicare Advantage enemies trying to get you to understand that all they want to do is have the government in charge of things. So let's go back here. When Medicare Advantage plan, beware of promises. These private insurance alternatives to Medicare are growing in popularity at the same time that they're under scrutiny for their sales tactics and coverage. And that is absolutely accurate. But about 25% of participants reported paying more money than they expected for copays. That means their share of treatment expenses is called a copay, or sometimes a co-insurance also. Let's say 25% of the Medicare Advantage participants reported having to pay more than they expected to for copays and for drugs, for medications. And nearly 25% said that service providers or coverage for certain procedures were limited, according to this survey that apparently we're reporting the results of. Only 10% of those surveyed expect to switch plans, though. Nearly 20% of participants said they had difficulty receiving care due to delays caused by the prior authorization process. Now, that's something that does not occur in regular Medicare or Medicare supplements. And 10% reported that they were overbilled for their plans. Yet, despite other concerns, these and other concerns, only about 10% of participants said they anticipate changing health insurance plans in the next year. While some Medicare Advantage plan members felt frustrated with their coverage, most enrollees expressed satisfaction with their benefits. In most cases, enrollees could resolve their greatest sources of frustration with a better understanding of the plan's offerings and details. The survey showed that most people are enrolled in Medicare Advantage plans to save money and to increase coverage. Many survey participants listed factors such as affordable costs and out-of-pocket expenses, as well as prescription drug coverage, as positively influencing their responses. The survey included questions about premiums, customer service, and provider networks. The median age of respondents was 69 years old. Okay, but when we go back to the headline, it says many Medicare Advantage members find challenges with their plans. And I've always said that Medicare Advantage is a type of medical insurance plan that could disappoint you. It doesn't disappoint everybody. Not everybody has a bad experience, but enough people have bad experiences that I don't want to offer it to my clients because I don't want to have unhappy clients. And speaking of being unhappy, if you like commercial spots, this will make you happy. You get to listen to a few of them. Let's take a break right now. I hope that was enlightening and entertaining. Moving on to other items of discussion, I had a visit from a friend who is also a client. Yesterday, she popped in. First thing she did was she sent Mary she's a friend of both of ours. She sent Mary a text saying, OMG, my new premium for my Medicare supplement plan, which I sold her, is $996. Is that possible? Is that what I'm going to have to pay from now on? $996. And so I said to Mary, can you find out what the heck she's talking about? And Mary said, well, yeah, I'll try. And she came back and said, well, she invited herself over. So here she comes. Actually, it took a couple hours for her to show up. But she did arrive. She pulled into the driveway in her very nice Mercedes. And she came in the house and sat around and talked to Mary for a long time. And then we talked Medicare. She showed me her bill. It's for an annual premium with Blue Cross Blue Shield of Illinois. And I sold her and convinced her that her best bet was the high deductible plan F, because she is old enough to be able to be eligible for plan F. And I said, the plan you want is the high deductible plan. So her annual premium notice for high deductible plan F had arrived, and she pays annually, and it was a total of $996. And she was horrified because she says her recollection is that last year she paid something on the order of $600 and some dollars. And I know for a fact that the plan premium for a high deductible plan should not jump all that much. So I'm suspecting that her recollection of paying 600 and some dollars last year might not be accurate. But in any event, when you divide $996 by 12, you get $83. So her premium is $83 a month. She's a few younger than Mary and I, and we pay in the neighborhood of $100 a month for a high deductible plan F, which was our only choice for high deductible at the time that we entered Medicare. Our friend, who is a few years younger, really has the same sort of plan, but she's paying less than we are because she is younger. Blue Cross Blue Shield of Illinois is always going to be more expensive than many of its competitors because their charter says that they cannot put people through medical underwriting with the object of denying them coverage if they're too sick. Medicare, Blue Cross Blue Shield, Medicare supplements will accept anybody, no matter what health history is. So that means that they have to pay out more in claims every year. So they have higher operating costs, and hence she has a premium of $83. Whereas if she were in Tennessee or some other places in the country, she might have a premium of $30 or $35. So it's all a function of where you are. And she likes having Blue Cross Blue Shield of Illinois coverage because every doctor, she says, treats her with more respect when she shows up with that ID card from Blue Cross Blue Shield. So if she had been accurate about having her annual premium last year being somewhere in the 600s, then what I did was I did a little math, and if she was accurate about that, then I took $699 and divided it by 12, and her monthly premium then would have been $58. I can't believe that her premium jumped from $58 to $83, but I know that if that's the case, the same premium increase if she had Plan G with the same company and lived in the same area would be much greater than the $25 we're looking at here. So I'm hoping that her memory, her recollection is just a little bit inaccurate. Her $83 a month seems right in line with what Blue Cross Blue Shield is charging people in her age bracket for me. Now, I also got, this is pertinent to the same thing, notification from one of my companies, Mutual of Omaha, that they're having a rate increase in Washington State. And so the increase, well, just as I predicted to people when I tell them that the best plan to take is the high deductible plan, because the Plan G is going to increase faster by larger increments and more frequently than the high deductible plans are likely to do. Not every time, but I think almost all the time. So this notification from Mutual of Omaha in the Washington State, their Medicare supplement Plan G is going to have a 16% rate increase. High deductible Plan G is going to have a 0% rate increase. Now, if you had said, I'm afraid of the risk involved in the high deductible plan because I don't like paying a high deductible. Well, I've explained before that it's not required that you pay a high deductible. You're just going to have some co-insurance. You're going to have to pay the 20% share for your medical expenses, your doctor's visits, or whatever medical treatment you have that's covered by Medicare. Medicare is going to pay 80%. You're going to have to pay 20%, but what do you get in exchange for that? You get a much less expensive Medicare supplement plan that eventually, if you have a bunch of medical expenses, will turn into a regular Plan G with all the protections that Plan G offers. Now, this morning, I got an email from a client of mine who's a pretty meticulous guy. He strikes me as a guy who is a detail-oriented guy, and he sent me a photograph of a letter from his insurance company that I sold him, because I sold him the high deductible plan. And this is from one of the finest Medicare supplement insurance companies in America, United American. They're down in Texas. And you may not know who they are because they don't spend a lot of money advertising, which helps to keep the rates under control. So he sent me a photograph of his EOB, his explanation of benefits. And on the EOB, it states that he has had some charges, $132, and that has been applied to his deductible, his high deductible Medicare supplement plan. He has now met 200 and let's see, can I read the $245 of his $2,800 high deductible out-of-pocket limit for this year. So that tells me that he might have had a couple of doctor's appointments, but he hasn't had any serious expensive medical treatment. And so he has forgotten the stuff I told him about his high deductible Medicare plan. So he wrote me and he said, "Good morning. I'm confused about how this works. Bottom line is I have parts A and B of Medicare. I have a Medicare supplement, and I have a drug plan. I know annual Part B deductible is around $240, and I thought the supplement covered the 20% difference. Does the attached image, meaning the explanation of benefits letter that he received from his carrier, does the attached letter mean that I could still be liable for $2,800 minus the $240 annual Part B deductible? Please explain how this all works. Thank you, Doug." So I answered him right away. I said, "Good morning, sir. Your understanding is correct. The maximum out-of-pocket you might have to pay in the event of a very, very bad series of medical charges is $2,800. That is the high deductible for this year because you've got a high deductible plan, and it will change in tandem with the consumer price index each year. The good news is that this would only happen if your Medicare approved expenses reach or exceed $12,800 within this year. For most people, that would be an unlikely occurrence, but certainly within the realm of possibility. That is why I like to remind holders of the high deductible plan of one other important factor. If you had selected Plan G instead, there would have been a much larger monthly premium charge, often around $100 per month more than the current premium for high deductible plan. If we take that $240 Part B deductible plus the monthly premium savings and subtract them from that $2,800 high deductible, the remainder would be maybe $1,360. This is the true extra out-of-pocket cost that one would incur in the event of a worst-case year of very large medical expenses. One final fact to consider: historic trends indicate that the monthly savings will grow and the amount of risk will shrink with the passage of time. The Plan G rates will increase in larger and possibly more frequent increments, and the high deductible plan will have smaller and less frequent premium increases. We just looked at Washington State, one company raising the rate 16% on Plan G, 0% increase on high deductible Plan G. So the bottom line is eventually the savings will equal and then exceed the amount at risk each year. I hope this is a clear explanation. Please let me know if you have additional concerns. So that was my correspondence with my client who has high deductible Plan G. I don't see Randy jumping up and down, waving his arms, so I'm guessing, I forgot to tell the audience, my timer crapped out today. So I have no idea how close we are to the end of the episode.
You have 5 minutes and 36 seconds.
Well, let me find something that will spark 5 minutes and 36 seconds of blather. I know our vice president would not have a problem with that, but let me see. Hospice. Would you like to talk about hospice? What a happy.
You mean
happy
word
thought.
word salad? Word salad. Okay.
Word salad Annie. Word salad
That's
Annie.
right. Word salad Annie. Yeah, that's a good name.
Let's see if I can make some sense out of hospice. The title of this article by Diane Omdahl, one of my favorite Medicare experts in the U.S., is got questions about Medicare hospice services. Here are some answers. And the article starts out, how does Medicare work with hospice? Many studies have shown that earlier end-of-life care can have a positive impact. Reduced administration of unnecessary medications, fewer hospital admissions, and less depression in survivors. In too many cases, though, it was a last-minute decision to get hospice coverage, and neither the patient nor the family reaped the full benefit. Somehow, the highlighter took a few sentences out of this. Oh, I see. As a home care nurse, I witnessed the value of hospice care. Now, this isn't Doug talking. This is Diane Omdahl, the author of the article. So a brief Q&A may plant the seed so that those who may face an end-of-life situation in the future will know that hospice can help. So the first question is, what is hospice? Hospice is a holistic approach to care focusing on the care, comfort, and quality of life of a person with a serious illness who is approaching the end of life. The next question is, how long has hospice been around? The idea of a specialized program for the dying began in England. It was first discussed in the U.S. in the early 1960s. In 1985, hospice became a permanent Medicare program. The next question is, what is the patient's situation? The patient must give up curative treatment and expect palliative care, focusing on pain relief and symptom management. This may be a reason that hospice services are often delayed. A hospice physician and the patient's primary physician, if available, must certify that the individual is terminally ill with a medical prognosis of 6 months or less. If the patient lives longer than that and still meets the qualifications, there can be recertification. I think Jimmy Carter's been in hospice for a couple of years now. I think every time a 6-month period ends for him, they just recertify him and continue with the hospice treatment for him. How does hospice work? An interdisciplinary team made up of a hospice doctor or a medical director, nurses, social workers, counselors, dietitians, home health aides, clergy, volunteers, all of those people work with the patient and family. There are different levels of care, from routine and continuous home care to general inpatient care. The goal is to make sure that a person's last days may be spent with dignity and quality. And the next question is, what is the cost sharing when Medicare covers hospice services? Part A, hospital insurance, covers hospice care. A Medicare certified hospice must provide the services. There is no deductible, and the cost is a 5% coinsurance. That doesn't sound right. Most coinsurance under Medicare is 20%, but it says here the only cost is a 5% coinsurance for inpatient respite stays and hospice-related medications. Where can a patient receive hospice care? Patients receive this care in their homes, an assisted living facility, a nursing home, a hospital, a hospice facility. The Medicare hospice benefit does not cover room and board. How can you find a Medicare certified hospice? Go to Find and Compare Providers Near You website. Apparently, you put that in your computer and that website will pop up. Click on Hospice Care in the left sidebar. What is the benefit for the patient's caregivers? There are many benefits. The interdisciplinary team that provides support, expertise, and help with planning. Caregivers can get a break through the services of volunteers or brief respite stays. And after death, there are bereavement services for several months. That's grief support. What if the patient has a medical issue not related to a terminal diagnosis? For instance, a patient with lung cancer sprains his ankle. Ooh. Part B, medical insurance, would cover the X-ray and the physical therapy, and Part D, as in Delta, prescription drug coverage would help pay for the pain medication. How does a hospice work for those who elected Medicare Advantage? Medicare Advantage plans cannot provide hospice services. This probably goes back about 40 years when both Medicare hospice services and Medicare Advantage plans were getting started. There wasn't enough data to evaluate the impact that each would have on the other. Terminally ill beneficiaries who elect this coverage will receive care under Part A through a Medicare certified hospice. The Medicare Advantage plan will continue to cover the patient's issues like a sprained ankle not related to the terminal condition. For a short time, it appeared things might change. In 2021, the CMS, the Centers for Medicare and Medicaid Innovation, wow, that's not CMS. Anyway, they started a 3-year program to test the inclusion of hospice services in Medicare Advantage plans. In the first year, 53 plans participated. In March, about a year and a half ago, in 2023, CMS decided to extend the model for 5 more years through 2030. And then just 1 year later, in March of 2024, CMS announced that it was ending the program as of the end of December 2024. CMS cited operational challenges and decreasing participation. Hospice care delivery and payment work differently from the Medicare Advantage model. This year, there are 78 plan benefit packages, down from 119 in 2023. So here is the final question. There's much more to learn. Now, that's not really a question, but it's in caps at the head of the paragraph, just like the other questions were. Hospice is not something people want to think about or talk about, but it is something that many of us will need. This little story, this little article is just a basic introduction, and you can learn a lot more by searching for additional information on the internet. So that's hospice for you, and I bet that burned up the 5 minutes I was trying to kill. Is that right, Randy?
Yes, it did.
Thank God. I didn't waste any quarters today.
No, we really kind of landed just right on the 75-cent mark, so we don't owe the company any more money. They're just really happy with us for not blowing our 76th cent.
That's the way I like it.
So anyway, we need to go ahead and land this plane. But before I do, as you know, those of you who listen to us know that I've got some business to take care of before I land the plane. And I think it's important stuff. Grab your pencil. The email address that you can reach out to Doug at is dbj@mlmmailbag.com. Don't forget, Doug is licensed nationwide to help you with your Medicare supplement planning. Check us out at the website, medicareforthelazyman.com. Keep watching there because we're right in the process of building a new fancy Dan, bells and whistles, pretty colors website. It'll be a little bit, but keep looking. And we would also appreciate it in your wandering through the jungle that is the internet. Drop a review for us. The numbers are important. And as I said last time, I can't believe we're in the second half of this year already, but we are. So bottom line is, thank you for joining us. You could have been a number of different places, and you weren't. You were with us, which is exactly where we like to have you. But as always, if you weren't checking your watch, you have just spent about 32 and a half minutes with Doug Jones, the insurance guy from Oklahoma originally. He really is an Oklahoma boy, but he's living in the low ground out in Illinois some. I don't know why this is, but he just continues to tell me someday he'll get back home, and I am looking forward to that.
Well, you can tell I'm from Oklahoma because of the stupid stack of cardboard boxes that are holding my microphone up in the air. But thank you for joining us, ladies and gentlemen. We thoroughly enjoyed having you with us, and we're looking forward to seeing you again at our next episode. Bye-bye.